Josie Duggar has been admitted to a hospital for health reasons, prompting waves of concern, speculation, and intense media scrutiny. The announcement came as a jolt to fans who have followed the family's highly publicized lives for years, instantly igniting conversations across social media, news outlets, and fan communities. Josie, often regarded as one of the more private members of the family yet still visible in the public eye, now faces a situation that blends personal vulnerability with the relentless gaze of public attention. From the moment news broke, the story has unfolded with dramatic intensity, exposing the intersection of health crisis, family dynamics, and the pressures of visibility that characterize life in the Duggar universe. At the heart of this story lies a broader theme: the collision of personal health, family responsibility, and public scrutiny. For Josie Duggar, being hospitalized is not simply a private medical issue. It becomes a public narrative, where each detail, each update, and each family statement is interpreted, analyzed, and discussed by a wide audience. In a family known for tightly managed appearances, ideological commitment, and meticulous public presentation, the hospitalization magnifies both emotional vulnerability and narrative significance. This event reveals the tension between personal privacy and public expectation, illustrating how individual well-being is inexorably linked to family reputation, media coverage, and fan engagement. The timeline leading up to this hospitalization underscores the seriousness and escalation of concern. In the weeks preceding her admission, insiders observed subtle signs that Josie was experiencing health difficulties, fatigue, visible stress, and intermittent medical consultations that hinted at a developing issue. While the family maintained a composed public front, attentive observers noted cryptic social media posts and carefully worded messages that suggested something was amiss. These early indicators, though understated, foreshadowed the eventual hospitalization, revealing the careful navigation required when private health matters intersect with the obligations of public visibility and familial expectation. Upon her admission to the hospital, the gravity of the situation became apparent. The environment of the hospital, with its constant monitoring, structured care protocols, and high-stakes decision-making, created a backdrop of tension and urgency. Family members, including parents and siblings, were reported to be by her side, managing both emotional support and the logistical coordination of care. Each moment of monitoring, each medical decision, carried profound significance, not only for Josie's immediate well-being, but also for the emotional equilibrium of the family unit. The hospitalization thus becomes a lens through which the pressures, responsibilities, and resilience of the Duggar family are vividly illustrated. Analyzing the family dynamics surrounding this health crisis reveals layers of influence, oversight, and emotional negotiation. Within the Duggar household, decisions regarding care, communication with medical staff, and public disclosure are rarely isolated. They involve a network of familial oversight, hierarchical guidance, and collective coordination. Josie's hospitalization illustrates how these dynamics operate under pressure. Her personal needs, family responsibilities, and public narrative management all converge, requiring delicate navigation. Observers have highlighted the balance between personal agency and familial authority, noting how high-profile individuals must simultaneously attend to their health while negotiating the expectations and emotional demands of both immediate and extended family networks. Public reaction to Josie's hospitalization has been intense and immediate. Social media platforms were flooded with messages of concern, empathy, and support, alongside speculation regarding the nature and severity of her condition. Analysts and commentators examined prior behavior, family statements, and social media cues, attempting to piece together a timeline and interpret potential underlying causes. This intense scrutiny reflects a broader cultural phenomenon. In highly visible families, personal health crises are rarely private. Every development, every statement, and every update is filtered through a public lens, amplifying both emotional intensity and narrative significance. The narrative arc of this event follows the structure of a dramatic unfolding. Early signs of health concern establish the initial tension, escalating through subtle indicators and private consultations, and reaching a dramatic crescendo with the hospitalization. The emotional stakes are heightened by the interplay of uncertainty, familial responsibility, and public visibility. Each stage, the initial warning, the escalation, and the hospitalization, contributes to a storyline that is both intensely human and rich with dramatic resonance. This progression mirrors classical narrative structures, blending exposition, rising tension, and climactic action, making the story compelling not only as news but as a human drama. From a medical perspective, hospitalization underscores the seriousness of Josie's condition, necessitating close observation, interventions, and expert care. Each medical decision, tests, monitoring, and treatment carries significant implications for both immediate outcomes and long-term health. The intersection of medical necessity and familial management illustrates the complex responsibilities faced by caregivers, particularly in high-profile contexts where decisions are observed, interpreted, and discussed publicly. Kendra's hospitalization, juxtaposed with Josie's situation, also highlights the ongoing emotional demands placed on families navigating simultaneous health crises under scrutiny. Culturally and socially, this hospitalization operates on multiple levels of meaning. Within the Duggar universe, health crises are not purely private. They are imbued with symbolic, relational, and public significance. Family statements, social media updates, and public interactions serve dual purposes, conveying factual information and demonstrating resilience, composure, and commitment to familial norms. The hospitalization thus functions as both a medical event and a performative act, highlighting the interplay between personal vulnerability and public representation that defines life for high-profile families. Emotionally, the story is deeply layered. Early indications of illness, ongoing concern, and the eventual hospitalization create a continuum of fear, hope, and emotional engagement. Josie's experience reflects both personal vulnerability and the heightened stakes of public scrutiny, amplifying each emotional response. Analysts emphasize that the convergence of personal health, family responsibility, and public visibility produces a unique intensity, where each decision, each update, and each interaction is laden with significance. The hospitalization is therefore not only a medical event, but also a profound emotional crucible for both Josie and her family. The reactions to this hospitalization further underscore the intertwined nature of personal and public experience. Fans express empathy, prayers, and concern, while family members must